Hello, and welcome to this brief overview on community engagement. In this module, we will touch on the following topics. What is community engagement? Why is community engagement important? When would you engage the community? Explore some models for community engagement. Share a few tools and techniques for engaging the community. Review an example from the field. Have a quick quiz and end with additional resources. What is community engagement? The Public Health Accreditation Board defines community engagement as an ongoing process of dialogue and discussion, collective decisions, and shared ownership. In other words, community engagement is the process of working collaboratively with and through groups of people linked by geographic proximity, special interest, or similar situations to address issues affecting the well-being of the community. Community engagement can also be seen as a continuum of community involvement. This is a modified diagram of the International Association for the Public Participation IAP2 spectrum. The spectrum shows differing levels of participation. The public's role in the participation process depends on the goals, timeframes, resources, and levels of concern in the decision to be made. Why is community engagement important? As a cornerstone of effective public health practice, involving community members in making decisions and taking action is critical. Successful community engagement builds skills and capacity within the community. It is a powerful vehicle for bringing about environmental and behavioral changes that will improve the health of the community and its members. It often involves partnerships and coalitions that help mobilize resources and influence systems, change relationships among partners, and serve as catalysts for changing policies, programs, and practices. When you want to increase community participation and involvement, mobilizing the entire community leads to more effective results. To increase community empowerment, enabling them to take action, influence, and make decisions on critical issues. To build community capacity, participation in community engagement efforts can offer people the possibility of developing needed resources, knowledge, and skills. To conserve and pool resources, and to increase the likelihood of sustainability due to diversity of participants. Here are some methods of community engagement. Healthy Cities, Healthy Communities is a theoretical framework for a participatory process by which citizens can create healthy communities. Assets-based community development, also called ABCD, is a methodology for a sustainable development of communities based on their strengths and potentials. The county health rankings and roadmaps provide guidance and tools to understand the data and strategies that communities can use to move from education to action. Mobilizing for action through planning and partnerships, also known as MAP, is a strategic approach to community health improvement. Here is a short list of tools and techniques to assist you in navigating through the levels of public engagement. As you can see, advisory committees, community fairs, or events are ways to inform, consult, and gain active involvement from the community, whereas education and awareness programs and fact sheets are a means to share information. The tools and techniques of Imagine, learning circles, and policy action teams provide a way to share information and actively involve, collaborate, and empower the community. Now let's see community engagement in action. This is an example of information sharing from the Pierce County Community Health Improvement Planning process. The group is gathered to learn and understand the issues facing the community. The community is engaged by sharing their feedback on analysis and decisions. Their concerns and aspirations are gathered and formulated into recommendations, thus empowering the community to collectively make decisions and take action to improve the health and well-being of Pierce County. Let's test your knowledge. What is community engagement? A. An ongoing process of dialogue and discussion, collective decisions, and shared ownership. B. A one-time event to solicit community feedback. C. Working collaboratively with and through groups of people linked by geographic proximity to address issues affecting the community. D. A process where individuals develop plans for the benefit of community. E. A and C. And the answer is E. Both A and C are correct. Here are some useful resources and a list of other related topics covered in this series. You can find them on our YouTube channel. Search for Public Health Centers for Excellence and click on our logo. We look forward to hearing from you, and if you would like further assistance on this and other performance management topics. This presentation is part of the Performance Management in Public Health Training Series, presented by Washington's Public Health Centers for Excellence and funded by a grant from the Centers for Disease Control and Prevention. The centers are located in the Spokane Regional Health District and the Tacoma-Pierce County Health Department. Our goals are to help local health jurisdictions and tribal agencies improve their results, prepare to meet public health standards, and achieve accreditation. In addition to this training series, we offer technical assistance and resources in performance management to improve public health outcomes. If you would like to talk to us about how we might assist your organization, our contact information is on the preceding slide.